Hi, and welcome to our first episode of Lead with the Children, a Zoom recorded webinar produced by Fortify Children's Health Network. My name is Heather Quillian, and I'll be your host today. I'm a general pediatrician in Charlottesville, Virginia, in a busy practice that's associated with the University of Virginia. And my guest today is Dr. Colleen Kraft. She is many things, including the 2018 past president of the American Academy of Pediatrics. She's currently an attending physician at Children's Hospital of Los Angeles. And notably for today's discussion, she led the Pediatric Accountable Care Program at Cincinnati Children's Hospital from 2014 to 2017. She serves on the Board of Managers for Fortify Children's Health. So Dr. Kraft, welcome and thank you for taking the time today to talk to us about HEDIS.
Well, thank you so much for inviting me.
Yeah, well, I'm excited. I have a lot to learn. So what I thought we could do over the next 15 minutes or so is sort of review the definitions and the foundations of HEDIS measures. Many of our physicians have repeatedly asked us to define them and to explain why we use them. And so it would be helpful for me too to kind of start at the beginning, because I'm going to be honest, before I started using Healthy Intent, I don't think I'd really heard much about HEDIS, or if I had, I didn't give it much thought. It was sort of in one ear and out the other. But now I feel like I'm hearing it more and more, and I want to understand it better. So I was hoping maybe you could help explain it kind of in the non-jargon terms, sort of what is HEDIS?
Absolutely. So, and there are so many acronyms, particularly as you get to insurance companies and management and some of these other things. But HEDIS stands for Health Effectiveness Data Information Set. And what this is it's a widely used set of performance measures in the managed care industry. They're developed and maintained by NCQA, which stands for the National Committee for Quality Assurance. NCQA is a nonprofit organization that was founded in 1990 to help to measure quality. We've all talked about we provide quality care, but how can you tell? What are your metrics? And NCQA really filled that void and began to actually give us some metrics in terms of what is the care and what's the quality of care that we give to our patients and how we improve that.
So before the land of NCQA, was there a way sort of for health plans to be held accountable to standards or to be accredited? What was the world like before that?
So before 1990, there was not much in terms of quality metrics. There were guidelines out there, but if you adhered to the guidelines or you didn't adhere to them, no one could tell. So this was really the first stake in the ground in terms of saying, okay, we have defined immunizations, we have defined lead screening as a quality metric. Now you, pediatric practice, how do you measure up with your patients?
So I guess it allowed consumers to pick their healthcare plans, or it allowed healthcare plans to hold practices accountable, or in an ideal world, a combination of the two?
Really, it did both. So for consumers, it essentially said this practice does all of the things that we would like a pediatric practice to be doing in terms of the care for their children, in terms of doing the right screenings, in terms of doing immunizations, making sure that your kids come in for their well visits for the consumer. For the health plan wants to get their biggest bang for the buck in what they're doing and paying us. And so for the health plan, they want to know if that somebody is our patient, that we've got them fully immunized, or that they're coming in for their well visits, that they're doing the preventive care that we all know is effective for these kids.
Right. And I guess for us as physicians, it helps remind us, even though we think it's second nature, just exactly what it is we should be doing, right? To kind of, put that tickler in our brains to say, hey, we got to get these kids in.
Well, it is, and it sets a standard for the different visits that you have, because as you know, parents come in with all kinds of different questions and all kinds of different concerns. But within that, you can introduce those individually. At the same time, make sure that their child is up to date with immunizations, just like the next child that you're going to see.
Okay, so HEDIS is sort of the standard to measure and compare performances. And it stands for, let me see if I get this right, Health Effectiveness Data Information Set.
Correct.
Okay.
Absolutely correct.
So I think what would be helpful for me, and maybe I hope for those watching, is to sort of talk about HEDIS measures in more specifics, and particularly how they might relate to our network, Fortify.
Absolutely. So you want to take a look at those particular metrics and what's happening at a certain age.
Okay.
And
Should I have some here I can share
yeah,
with you. Would that be helpful?
we can
Okay.
take a look
All right.
at it. So yeah.
Give me
Mhm.
1 second. Let's see if I do this right. Yay. You got it?
Yes, absolutely. There you
Okay.
go. So you're already looking at the well child measures. So the W15 is the annual assessment of well child visits in the first 15 months of life. And what HEDIS wants to see is that children who've turned 15 months of age have had 6 or at least 6 well child visits with their primary care physician in that first 15 months of life. And so when health plans look at HEDIS, they look at a numerator and a denominator. If you look at the number of eligible members who turn 15 months of age, you want to look for the percentage of those kids who've had 6 well visits in that amount of time. And that tells you a couple of things. Some of what's really valuable for primary care pediatricians is that if those kids have had those 6 well visits, chances are really good that they're up to date on their immunizations. If they've had those well visits, chances are really good that they're up to date on their screenings, and that you have parents who receive some of the really important anticipatory guidance that we give to our parents during this time.
Yeah, that's a really good point. And you know, when I first looked at this measure, I thought, wait a minute, like by their first 15 months of life, like what about the 15-month visit? Does that not count? But then when I started doing the math, I thought for most practices, you know, we have a newborn visit, a 2-week visit, 2, 4, 6, 9, and 12-month visit. So even before the 15-month, that's 7. So there is some natural wiggle room built in, which I thought is kind of nice. You know, but one question I have is,
right. Mm-hmm.
you know, what about if there's a baby who's in the NICU for the first 4 or 5 or 6 months of her life, or a baby moves into my practice at his 9-month visit? Like, is there any way, if they're coming from a practice outside the network, that I would ever get sort of credit for those visits, or those children would ever meet the metric?
You would have to really look and see what they had done before. But generally what will happen is health plans are not going to count those kids. They're going to count those kids who've been in your practice for those 15 months. And we'll take those kids who haven't been, or those kids who meet those exceptions, like the NICU grad, out of the denominator. One really important piece of this, though, and this is something that Fortify is really helping out with, is this whole concept of attribution. I remember being in primary care and getting a note from the healthcare plan saying that your immunization rate is at 70%. And I know that I vaccinated my kids more than 70% of the time.
Right.
And what it turned out was when I looked to see who they were counting as my patient, there were a lot of people who weren't my patients. The concept of attribution is this, that your patient counts as your patient. And the only way that you get accurate attribution is by a group of providers really filtering through those patients to see that that patient is Dr. Quillian's patient or Dr. Kraft's patient. And that's one of the activities that Fortify is doing, because if there's going to be a reward associated with meeting a HEDIS metric, then you've got to have the right patients in your panel, and you've got to get credit for those right patients in your panel. And that's really part of what Fortify is doing. So Fortify supports HEDIS metrics. They want to make sure that kids get those quality metrics and that quality care. They're actually showing you on Healthy Intent what kids are getting those immunizations, and what kids are meeting those metrics and who's not. Because what does that do? That, as a practice, makes you then call those families who are due for that well visit to get them in there.
Yes,
Make sure that they come and get the care that's there. But at the same time,
really helpful.
they're looking at the data to make sure that those kids who are your kids are counted as being your kids, so you get credit for this. The other piece that's really important about this is that if the health plans come to you and say, yes, it's important that these kids get their 6 well visits, that they get their screenings, that they get their immunizations, we as pediatricians can turn around and say, hey, then it's important that you pay me for these screenings and you pay for these and cover these well visits and that you cover the immunizations. So it really becomes kind of a bargaining chip. If we're doing the care that is recognized as being effective and important care, that we're paid promptly and we're paid adequately for this.
Yeah. I've really enjoyed having the Healthy Intent platform as an easy way to kind of see who I'm responsible for and how I find them, to reach out to them, to close the gaps. I think that's one of the best aspects of the registry. And you're right, it seems like attribution is everything, right? In population health, if we don't have correct attribution. And so I know that that the Fortify is working really, really hard to make sure that the patients are correctly attributed. And it's really exciting, I think.
I think it's also an opportunity to look at your data and meet your patients when where they're at. So if you find somebody who's missing well visits or they're missing immunizations, it gives us an opportunity to reach out to that family to try to make that appointment, but try to find what those barriers are as well too. Maybe somebody works during the week and they can't get in there. Maybe you can help them brainstorm who can bring that child in, or could you at least catch them up with a well visit or immunizations on a Saturday? So it really helps us understand our population and work together with them as our partners in order to improve their child's care.
Yeah, and I think, I stopped sharing our screen, but again, I think that the insurance companies recognize that we cannot do it perfectly, right? Like, but our goal is progress, not perfection. That we continue to try to reach out to these children and to close the gaps in care and find them. But that first metric we looked at, right? Our target was 66%. So I think the other thing that was important for me as I started learning about this is I need to focus on progress, not perfection. Like I won't ever be able to do it perfectly, even no matter how much I try. And so I think that's important for us as physicians to hear also, is that, we just keep trying, And even if we're never going to meet a metric, like with a certain patient, because they've moved into our practice, say, that's, of course, we still keep doing our outreach, right? And bringing those patients in.
Sure, because your experience as a pediatrician is that you take care of your patients and you immunize all your kids who are coming in there. But what this does is it gives you a broader look of who's under your umbrella
Yes.
and who are you not reaching. And so
Yes.
as pediatricians, we care about those kids too. And
Of
it
course.
helps us become creative in terms of how do we bring them in and how do we get them the care that they need.
I
And
agree.
I think the idea of progress and not perfection is important because we're always making progress.
Yes. Yes. We're always making progress and nobody's perfect, right?
Right.
Yes.
Right.
So what do you expect sort of in the future for HEDIS measures, and where do you think we're going with this?
I think that what's going to happen is that as pediatricians identify concerns with their children and concerns with their families, I think that we're going to need to be working with families, but also with health plans on how do we raise the bar? How do we change things with families? So think about vaccine hesitancy, big problem with our families. And how can HEDIS hold us responsible when we have families who don't want to vaccinate their kids?
Right.
Well, this is going to be something that we'd have to work with a health plan on. And I could see in the future health plans reaching out to families, plans perhaps putting a family in a higher risk group if they won't vaccinate their children, and that may result in a higher premium. But we all work together on this. And as we identify trends in pediatrics and some of those trends that are not so good with our families, we can actually use HEDIS as that benchmark to say, this is what we've decided is effective care and the right preventive care for a child. And how do we get there?
Yeah. That's cool. Thank you so much for explaining it more to me. I think it really helps to hear it in context and to hear your sort of expertise and your familiarity with it has been really helpful to me today. Thank you.
Well, thank you for the interview, and I appreciated being your guest.
Yay. Okay, we'll talk to you soon.
Okay.
All right, take good care. Bye.